This patient here has had an anterior cruciate ligament reconstruction using his medial hamstring, so the semitendinosus hamstring. And straight away we can look at this to see that the knee extension, the straightening of the knee, isn't as we would want it. And this is your priority after your operation, is to get your knee to straighten. When the knee is straight, the knee will feel more stable and it will feel more comfortable. So one of the methods we can use to get the knee straight is to support the heel, and then the weight of the leg passively allows the muscles that are tight at the back of the knee to pay out. So we call it passive extension. There's not an active component here where you're forcing it down. This would be something you would do if you had friends around and you were or watching a movie or reading a book. You could support the heel, leaving the back of the knee unsupported, and then the weight of the leg would, in the end, cause the soft tissue tightness at the back of the knee to dissipate, and that would allow the knee to drop back into a more straight position, which is more ideal. So any sort of bolster, it could be a roll towel. Here we're just using the little nose hole from the bed, and we place this under the heel. And we can see quite obviously here that the back of the knee is way off the bed and that the knee is bent. And the ideal situation here will be for the knee to straighten. Now once the patient's distracted and isn't as concerned about their knee, subconsciously they'll relax. And you'll relax at home hopefully, and you'll be distracted by whatever you're watching or reading or the conversation you're having, and that will allow the muscles to just let go. And with these tight muscles that are acting as a protection at the back relax, then the back of the knee will just pay out, allow the stretch to occur, and your knee will occupy a much straighter position. So probably periods of about 10-15 minutes are appropriate for this. So something under the heel, back of the knee just unsupported, sitting down. You don't want to feel vulnerable and have nothing at all behind the knee. Here we can see that it isn't very far for the knee to drop back before it would come into contact with the bed. So often sitting on the floor at home with your back against the sofa and something rolled up underneath the heel is ideal. So if we take the support away, then we can see that the knee drops back and becomes a little bit straighter. And we can see that that relaxation phase now, I can't get my hand under the back of the knee now, showing that that knee is now more extended than when we started. So that's the desired effect of doing this passive extension exercise, where you support the heel, leave the back of the knee unsupported, and then the knee is just going to drop back and occupy this more straight position, which is more ideal. When that happens, your kneecap is free to move. If the knee occupies a position where it's bent, then the kneecap is engaged against the femur, and this is one of the mechanisms where you can get anterior knee pain, soreness through the front here. So although the mechanism of getting the leg straight can be a little uncomfortable, once it is straight, it feels a lot more relaxed. So as the knee drops back into a straight position here, the kneecap becomes mobile, the soft tissues relax a lot more because the ligaments take over the control of the knee. Now, as we said, this is a hamstring repair for the ACL, and the main thing that we have to try and do now is get the knee to bend. So obviously the muscles that bend your knee are the hamstrings. So there's a great deal of inhibition and fear and worry sometimes about bending the knee. But the hamstring that's been used for the graft is semitendinosus, and this is the least important of your hamstrings. So you've got the big semimembranosus hamstring on the inside still remaining, and you've got the huge biceps femoris hamstring on the outside of the leg, obviously still remaining. So although it will be a little uncomfortable to do this, we need to get this bending started quickly, and we need to be confident that you are not going to be injuring the leg. You have the repair, and now what we're going to do is ask the patient to bend the knee. So if you could just bend your left knee for me. That's it, and that's about the limit that we've got to there. Now if we want to increase this range, what we can do is use the other leg. So we bring this right leg in front, and now we want the patient to produce a strong contraction with his left side, the quadriceps on the left. The right leg holds still, providing an isometric contraction of the left. So we're pushing hard with the left against the right for about 10 seconds. Now relax the left side, And now use the right one now to just oscillate into a new range. Now in this period following the contraction, we get the greatest relaxation in the quadriceps on the left. So we can use that period of relaxation to try and gain a little bit more flexibility in the knee, because the quadriceps will allow the knee to move more because they stretch easier as they're relaxed. So then we've now got this new limit, so we hold there. So again, you should be pushing down with your left leg against your right leg in this situation. Hold that contraction on for about 10 seconds and then relax. So allow the left leg to settle and then use the right leg again just to oscillate into a little bit more range. Just nudging into that discomfort that you might have at that point. And gradually you can creep this range up, and this is how you can be improving your range of motion even before you get the chance to see the physiotherapist after the operation. So there is no way you can hurt yourself doing this exercise. So it's a very, very appropriate way to try and improve your degree of bend. So now we lower the legs down. That's often a little uncomfortable on this operated side because the hamstrings are engaged to help lower the leg down. And now we ask the patient to just bend this left leg again on their own, and we see what the new range is like now. That's good. So now we can see that's significantly better than we were before we did the first lot of resistance. Okay, and lower down again. So this technique is called hold relax. We're providing an isometric hold of the left quadriceps working against the right leg. Following the isometric hold, we get relaxation in the left quadriceps, which allows the knee to bend further. And that's the way that you can gradually improve your range under your own steam at home without any risk of making your knee worse. Now sometimes when you contract your hamstrings, it can feel as though you've got some tugs and some twangs going on in the back. Now remember, where the semitendinosus has been harvested from, the actual tendon, the muscle belly will have bled. And this muscle belly, as it bleeds, will clot to surrounding tissues. And that might form adhesions, which when you do normal innocuous movements of everyday life, they might feel like they're pulling, giving you the sensation that you may have pulled your hamstring or torn your hamstring in a way. You won't be tearing your hamstring, you will just be releasing some of these unwanted adhesions that have formed. And this is a necessary evil, unfortunately, with this operation. So previously we spoke about gaining full extension of the knee when the patient was sitting up with the heel supported and the back of the knee unsupported. That was to gain the passive extension of the knee or the straightening of the knee. This is called prone hang. This is another mechanism for gaining this extension of the back of the knee here. We can see quite obviously here that the non-operated left side is dropped, nice and relaxed, and there's this sort of guarding, protective spasm here on the right side, not quite allowing that right lower leg to drop into extension and get the full extension of the knee. So again, just by hanging in this position, relaxing, maybe getting distracted by listening to some music or talking with friends, your brain will get distracted, and then this part of the leg will relax a little bit more, allowing that leg to drop back into a straighter position. So again, it's a passive technique. You're not using your muscles actively to contract to try and facilitate the straightening. We're just allowing the weight of the leg and hoping that some of this tension here is going to dissipate and allow the leg to drop back into full extension. This is also quite a nice position to then bend the knee from, because initially to bend the knee with the front of the knee rubbing against the bed or the surface you're laying on can be uncomfortable. Here we've laid so that the knee is protruding off the edge of the bed, and so if you want to bend your knee for me now, let's see how far we can go. Go on, bend up fully, go on, keep going, keep going, keep going. Squeeze, squeeze. So this is another position you could then do your hold relax technique, but you sometimes a little bit more comfortable not having the front of the knee where the surgery is taking place actually rubbing on the surface that you're laying on. So then we could contract the right leg against the left leg, holding that left leg fully still, getting a good strong static contraction on this right quad here for about 10 seconds, then relax the right thigh and then use the left thigh to facilitate a little bit more bend. So just oscillating, just nudging into that new range of bend. Now what's nice is when we take the left leg away is to try and control the lowering down of the right leg using the hamstrings on the right. So take that left one away and then lower down slowly with that right leg, and that's, as we referred to earlier, the eccentric contraction on those hamstrings on the right. So if you're at home and you've got a kitchen table which is quite high with some freedom of movement underneath it, you can sit on a surface elevated like this and try again to improve the range of bend of the knee. So here we can see this right leg that's been operated on has got quite a restriction to the degree of bending that it can achieve. So if we bring this left leg in front of the right, and now like we did when we laid on the front, if we now work with the right leg to try and straighten this right knee against the resistance provided by the left, here we're building up this static isometric contraction on the right thigh. Hold that contraction for a good 10-15 seconds, then relax, and now use the left leg in this relaxation phase to try and oscillate and bend the knee into a slightly better degree of flexion, slightly improved degree of bend. And then you can sit and repeat this. Now, again, you'll often appear to get a much better degree of bend in this position than you did laying on your tummy, because when you lay on your front, your thigh muscles are going to be on full stretch. So that's going to make the restriction to the knee greater, to the knee bending. In this position, you haven't got that restriction because the thigh muscles are in hip flexion, because you're sitting up, therefore there'll be less tension across the knee, and therefore the knee should look as though it bends better when you're in a seated position. So, following your operation, it's very important to get the full extension of the knee passively, which we've already looked at. Now we're going to look at gaining active extension. This means we're going to use your quadriceps here on the left to straighten the knee fully. And to show that the quadriceps are recruiting strongly, the exercise we want you to do is what we call a straight leg raise. Now, if we pull the foot up in this way, what we call dorsiflexion of the ankle, this enhances the recruitment of your quadriceps here and gives you a stronger contraction. So what I would advise you to do is pull your toes up, press your knee into the bed or the surface that you're lying on, and then engage in the quads, see whether you can lift the leg straight without the knee buckling. So right up, that's good, and lower down, and as you touch the bed, come straight back up again. So we can see here, this is a perfect example of a straight leg raise. There is no buckling of the knee, which we refer to as a quads lag. So if there's a quads lag, then the knee won't be able to maintain the full lockout, as we can see here. And we're getting a great recruitment here of vastus medialis, which has an important controlling influence on your kneecap. Perfect. So now we can look at the straight leg raise, but in prone lying, laying on your front, which again is going to engage the glutes, the hamstrings as a hip extensor, but again we're trying to get this leg to lift with the knee in full extension, so the quadriceps will be working on that aspect at the front. So if you can lift your leg straight now towards the ceiling. That's it, right up, go on, lift and down. Touch the bed and back up again. Keep that knee fully extended. Good, and down, and again. Lift. Perfect. And the final part of this straight leg lifting quartet is to use the adductors, the groin muscles here. So we're now laying on the right side, the operated side. We've brought the non-operated side across the front here. So this right leg fully straight, toes pulled up into dorsiflexion, and now you can lift this leg off the bed into adduction. So we're engaging here the big muscles around the hip, which are going to put a demand on the circulatory system, and hopefully that's going to improve the sort of flow of blood to the knee, and that will improve the healing process. Now, a way of getting some recruitment into the legs without actually touching the legs is to work other areas of the body. So if you feel capable of doing this, if we do some abdominal exercises, like some sit-ups from the ground in this position, then you will see that as the abdominals struggle to lift the thorax off the floor and into a sit-up position, the legs try to contribute to this movement by stabilizing. So we're going to get a really excellent recruitment of all the muscles of both legs as we try to get the patient to sit up. So I've asked the patient here to fold his arms across his chest, and now just try and do a sit-up for me. Right up, there we go. And we can see how the legs lift and lower down slowly, so the muscles engage again and sit up. And we're getting what we call this overflow into the distal parts of the body. So we're putting a big demand on the abdominal muscles here, which they're struggling to cope with, and as a result they're recruiting other muscles to try and facilitate the ability to sit up. So another way of us getting some recruitment of the legs without actually targeting the legs directly is if the patient, or if you feel capable yourself of doing some press-ups, you could do these exercises. So if we come up into a press-up position here, that's it. Now, toes are supporting you like this, knees lock straight, so we've got this great bilateral contraction of both legs, and now perform the press-up exercise, that's it. So now you're getting a great static stabilization here of the quadriceps while the upper body is working hard. And this is nice to improve your circulation generally, and rest there. So if you work the body or the upper body hard, the abdominals hard, then you'll get a greater cardiac output, which will improve your circulation at a time when you're probably feeling quite sluggish and haven't been doing as much exercise. And this improved cardiac output will perfuse the legs with more blood, bringing nutrients to the area that you've had the surgery on, and helping to remove some of the waste products that have been as a consequence of what's happened and the injury and the subsequent operation you've had. So getting the circulation agitated in this way will help facilitate the improvement. Now, particularly with this operation, which is a hamstring tendon being used as the graft, it's really important that we get some hamstring mobility going and some stretching. So as we've mentioned perhaps before, there's a potential when the medial hamstring has been harvested from here, the muscle belly will shoot up the leg a little bit, it will retract further up the thigh, it will bleed, and it may form some adhesions. Now those adhesions are forming at a time when there is less mobility. You're not feeling like being as active as you would normally do when you're fit and healthy. So unfortunately, that muscle belly can adhere down to other structures in a really inappropriate position, restricting your natural range of movement. And this can lend sometimes to people feeling as though they've pulled their hamstring and got these little tugs going on in the back there, which are quite debilitating. So what's important now is that we apply some stretch to the hamstrings. And this also is beneficial because it requires us to engage the quadriceps. So what we're going to do is bend the knee up. So we assume this position here where the thigh is now perpendicular to the ceiling. So as the patient, you will now link your hands behind the thigh together, and your job with your hands here is to hold that thigh in that position, not to let it deviate up or down, to try and keep that thigh nice and consistent with that perpendicular position. Now actively, we want you to straighten your knee using your quads. And obviously when you get to the limit of your hamstring mobility, that's where the tightness kicks in. Now this is a stretch, so we want you to sustain this position with the quads working, trying to straighten the knee for at least 30 seconds. So it's not a mobilization where we're doing the oscillations like we did earlier for the bending. This is a stretch that we're applying to these tight soft tissues, so we need to sustain the stretch. So you can see this one's been done in a straight line. We can now bias the stretch to either the outside hamstring or the inside hamstring by rotating the hip. So if we externally rotate the hip in this position, so you can see when I do that, the foot goes inwards. Now, if we straighten the knee in this position, that will be really biasing the stretch to your outside hamstrings, what we call biceps femoris, on this side here. And then we would sustain that for 30 seconds as well. Then if we come down again, now if we medially rotate the hip, inwardly rotate it, so the foot comes out, and then we now straighten the knee, the stretch is very much to the inside hamstrings, the semimembranosus, and the area where your tendon has been harvested from. So obviously we're likely to have adhesions there, so this one often feels the most pertinent of these stretches to do. And again, we're looking for that 30-second hold, using the quadriceps here to contract. They have an inhibitory effect on the hamstrings, meaning that we can gain a better stretch. So following your hamstring stretch, say you've held those 3 different positions for 30 seconds, you probably need a bit of a rest, but we can use this position to then facilitate further bending of the knee. So by leaving the hands where they were, we can now say to the patient, now try and pull your heel down to the bed in this situation, or down to the floor. So this is a position that always appears to give you more knee bend than we had when you laid on your front. And the reason for that is that when you lay on your tummy with your hip in neutral, some of these thigh muscles are on a greater stretch, so the knee bending appears to be less good. In this position, your hips are flexed, so these muscles at the front of the hip are in a relaxed situation, giving the appearance of a better degree of bend in the knee. So when we looked at this patient earlier, the knee bend looked at best 90 degrees. Now we can see that that would be 90, about here, and we've got another 10 or 15 degrees beyond that in this position, because we haven't got any restriction of tight hip flexor muscles at the front here. But despite that, it's still a very good exercise to do. To give yourself a break from the hamstrings is just to then try and oscillate and pull that heel in towards your buttock in that way, to try and again facilitate further bending of the knee. So we're looking at an ACL reconstruction here, and this particular patient has had a patellar tendon graft done. So they've taken a bit of bone from the patella, the middle third of the patellar tendon, and a bit of bone from the tibia at the insertion of the patellar tendon. So this has a slightly different impact on your rehabilitation after the surgery compared to those patients that have had a hamstring graft used for their reconstruction. So following a patellar tendon reconstruction of your ACL, it's extremely important to maintain mobility of the patellofemoral joint and the patellar tendon. So it's a good idea to mobilize your own kneecap, make sure you can move the kneecap or patella medially and laterally, like so, and also superiorly upwards and downwards. Obviously, this repair has used the middle third of the patellar tendon, so it will be easy for us to get adhesions forming here if you're not actually keeping this moving. So the more mobile you can keep this in that early post-operative phase, the better. Also, some sensitivity that you may have to touch here will diminish more quickly if you're using some moisturizer or some creams to mobilize this area. So once your dressings have been removed like they have here, you can get to work on this and move it around in this way. And this one's moving really lovely and really freely. Now on the model here, we can see exactly the area of the patellar tendon that's been harvested for the graft. Where the screw is here, this would be where the distal bone fragment has been harvested. They then take the middle third of your patellar tendon, which has been darkened here, and then there'll be a bone fragment from the end of the patella at the proximal end of the tendon here. So the patellar tendon is not excessively vulnerable because you've still got a good 2/3 of the tendon intact. So you should never think of these operations as being fragile, and you should never think of yourself as being particularly vulnerable after the operation. It's a sore operation sometimes, but it is not weak, and it will be extremely difficult for you to disrupt this repair. So your confidence can be, very good when you're going into your exercises, and you can be, safe, but also very positive about what you do with your exercises. Being overly cautious is not always a good thing, because then we can end up with post-operative complications of not gaining the full range of movement and not getting the swelling down. In addition to providing support for the leg, you can also use your Tubi grip to fixate your ice packs. So probably the best way to do an ice pack is to get a wet tea towel, make sure it is wet. If it's dry, you can give yourself an ice burn. So soak a tea towel, a nice thin one, through with ice cold water, fill with your ice cubes, fold it over, and then you can place it at the back of the knee. It's important to put an ice pack at the back of the knee because that's where all the blood vessels are. The front of the knee is very much about protection. It's very bony, so you could quite considerably put an ice pack at the back of the knee and also at the front, and then you could use your Tubi grip to hold them in place. So that would probably mean that you need to have a couple of these, one that you can keep dry and one that you use for when you're doing your ice. But as I say, icing is for making your knee feel more comfortable, and if the knee feels more comfortable, hopefully you feel more at home doing your bending and your straightening exercises and your recruitment exercises for the muscles, and it's those exercises that will help remove some of the swelling and get the normal function to return. By following an ACL reconstruction, your guidelines from your surgeon are usually to get going on the leg straight away. You may have a crutch or two crutches initially, but often the advice is to walk on the leg as comfort allows. Now, one of the things that can be really provocative to your knee is to be standing on the leg for too long. The knee craves movement, it likes movement, but in the early stages of your operation recovery, you don't want to be weight bearing too much on the knee because the knee could be quite irritable inside, and standing in one place can be particularly irritating for the knee, and that will result in a lot of swelling. So with walking, have short walks, putting numerous breaks where you may sit on somebody's garden wall or sit in a coffee shop, and not just doing one long strong walk, because that can be really irritating for the knee. The exercises you'll probably start with when you do will be things that we refer to as being partial weight bearing, like cycling or rowing. You won't be allowed to swim, and you shouldn't be swimming until your wounds are fully healed. So once you've had your post-operative check and your dressings have been removed and the specialists have suggested that your wounds are fully healed, then you've got the freedom of jumping in a swimming pool and exercising in a non-weight bearing situation like water.